focus on strategies to prevent fatalities and the need to encourage people to take vaccine. Well, several researchers are in place. Some of them have come out with results of the drugs, of the ways so as to reduce fatality, especially in the case of comorbidities. Now, one of them is, a drug, anti-inflammatory drug called tocilizumab or TCZ, that's for treating arthritis. Now, that helps increase survival among patients suffering from severe COVID-19, of course, symptoms associated with it, and that's what the results said in the trial after it was published in the Lancet Respiratory Medicine. The study was conducted at 11 public and private tertiary care hospitals in the country, and a total of 180 patients were recruited at the centers, 90 of whom were administered this drug TCZ, whereas 90 others only standard care. And a subgroup analysis of severe patients in two groups showed a lower mortality among those who received TCZ or tocilizumab, whereas compared to others. Now, to discuss further on this important aspect, of course, along with need for vaccination drive, we are joined with our first address the issue of comorbidities and, of course, risks associated with it as we address a broader issue of COVID-19.
Well, good afternoon, everybody. And it is largely known that the COVID mortality has always been associated with various comorbidities like diabetes, hypertension, chronic kidney disease, thyroid, hypothyroid state, various malignancies, and they are there because these patients, they usually have low immune response status. And because of these reasons, this new emerging viral disease, which we call always as an immunothrombotic inflammatory disease, viral disease, this is causing lots of morbidity and mortality in relation to the COVID-19.
Dr. Raina, how important, as we're discussing about the preliminary issues involved in this debate, how important do you think is it to first address the issue of comorbidities or risks associated with it? And in terms of why we're discussing it, as in last couple of weeks, we have seen rise in numbers. Although rise hasn't been as phenomenal a rise that we have seen in last 1 year, but certainly there has been rise nonetheless in small percentages. So issue of comorbidities, how important do you think is it in the context of this study?
Thank you for inviting me to Rajya Sabha TV. As Dr. Gupta pointed it rightly, when we have a pandemic, or for that matter, when we have a disease that is going to involve a lot of people, the default settings for measuring these diseases are the mortality. So if you see the disease, if you want to analyze the disease, you will say how many people are dying because of the disease. That's a default setting with which we mostly work.
Right.
And the higher number of deaths are reported in those who have the comorbidity. So unless and until you take care of these comorbidities, you are not going to address that default setting of deaths that are happening because of the disease. So probably what are the three key important things that we need to look at when we are looking at comorbidities? One is we need to inform the clinicians. Those who are treating COVID-19 patients with COVID-19 disease, as Dr. Gupta is there. So those who are treating them, they need to be informed because they will take care of these patients and will have the best care practices in place. So that's the one group that needs to be talked about. Second is inform the public. Those who have the comorbidities, they should know that they are at the higher risk and they need to take care of themselves and put in place those precautions which will prevent them from the disease. And third, very important point is with regard to comorbidities is to identify those diseases which are not yet listed on the comorbid conditions for this disease. As you know, the data is limited. We are still not very much full with the spectrum of the diseases wherein this disease will be very important. Those conditions wherein this disease will be very important. For example, most of us may not be very handy with how COVID-19 is affecting behavioral disorders, because behavioral disorders may per se not directly be influenced by COVID-19, but indirectly behavioral disorders will have an impact on COVID-19. So most of these things need to be taken care of when we talk about the comorbidities and COVID-19.
Right. Dr. Gupta, as we are discussing, ways so as to address the issue of comorbidities, how important do you feel this study on the TCZ the arthritis that administer drugs is important in this aspect, in limited aspect of course, like our attempt towards preventing the fatalities, the strategies as we address this issue?
Well, as regard to this particular IL-6 inhibitor toxicizumab, TCZ, what is happening, we have a very limited data, and real life scenario is a little different. What we have observed at our tertiary level center, we were not very comfortable with the TCZ administration, though we were trying to put as per protocols, as per international guidelines, but the results were not very encouraging.
Okay.
So I am I have my reservations since I am working in a level 3. My reservations are always there with this particular drug.
Okay. Right. Well, reservation nonetheless, Dr. Gupta. I mean, now if just shifting the focus on the issue of the vaccination. Now we have seen in the recent past when we started off with the first phase of vaccination, although I think we should congratulate ourselves, of course, to you people who actually made us arrive at this juncture of administering vaccination for COVID-19 in not just even an year. With the second phase arriving, what do you make out of the response so far? I mean, could it be better, or is it like fairly satisfactory?
Well, to start with, I would say the COVID-19 started with 19. Then we goes to 20. And Hindi we say 19-20 ka baat thi. So COVID-19 we were there. We were in COVID-20 now. But then now we have reached to the 21. So now definitely we are improving from 19 to 20 to now 21. So 19 से चले थे, 20 पे आए, 20 से हम 21 हो गए. So we are definitely moving ahead. And right now, if you ask me at Varanasi, at BHU, current data and current clinical scenario is little different what we had about 2 months back. And what we are getting, the younger generation, surprisingly, the patients are not older right now. Now we have the patient, all younger generation, 25, 24, 23, 30 years old persons, they are coming to our place and they are being admitted with little bit of the comorbidity or no comorbidity. So this is the current scenario, and definitely the vaccination program is given the boost to us, and we must continue. What I am expecting with the government to little change in the policy, they are more wiser. But still I am trying to tell the people that who are the spreader, who are spreading these disease. The younger generation, if you watch the market, you go to any market or any mall, you find what kind of the behavior of the younger generation, which is keeping on, not putting the mask, which is I must tell you, working in a red zone area, the biggest preventive aspect was the masking and cleaning your hand. And this was there. And this is not being practiced despite all the efforts by the health authorities and the government. People are not understanding. And that is why the younger generation is now coming up, because the vaccination is going on for the older people, elderly people, and with the comorbidity. So I would suggest, let it open to everybody. So we can prevent in 2 ways. We are preventing to the comorbid condition, people with comorbid condition, as well as the spreader also.
Right. Right. Dr. Rena, what has been the response so far in Nanda if we talk about the vaccination drive? I know in the first phase, there was some hesitation that was addressed later. And as we have started the second phase of vaccination, what has been response?
I think the response has been good now. We initially, if we look at the healthcare professionals, once we started going beyond 65-70%, we should say and thank everybody that our response to the vaccination was good. And with regard to healthcare professionals, we were able to achieve that 60 to 70% of vaccination proportions. That was a good number to have. But as Dr. Gupta pointed it very correctly, vaccination vaccinating a large number of people. If you look at people who are above 60 years of age, so you will have roughly 14 crore of Indians in that age group. Another, if you look at beyond 45 with comorbidity, another huge number will be added to it. So vaccination will be necessary if you want to control the disease. But beyond vaccination, we will also need to take care of what we have been doing very well till now. We have been using the social distance. We have been wearing the mask or hand hygiene. And as far as those with the comorbidity, the basic principles should stay the same. They should protect by limiting their interactions. If they have the comorbidity, they should try to stay indoors within their homes as much as possible. And if they are going out, they should take precautions while they go out and take care of that SMS. Wear a mask, hand wash. This is something that they need to care of. Keep the social distance. And if they have any comorbidity. Now here I will say anybody, any individual taking any kind of medicine should treat himself as having a comorbid condition. That should be the bottom line. So
Okay, that's important.
Anybody who is taking a medicine and has any feeling of a COVID-19 like illness, has acute respiratory infection, has influenza like illness, he or she should immediately report to the doctor. That is one way of, again, preventing the number of fatalities that may happen because of comorbidities with COVID-19. So probably these three things should always be there. And then Government of India's regulatory framework for vaccination is exceptional. Unless and until we follow that regulatory framework, we may not be able to target those who are in need of the vaccines the most. So that is something that needs to be in place. But beyond that, we also need to be doing what we have been doing very well for last 1 year. The social distance, the mask, and the sanitization of the hands. That is the key.
Right, that's important, and this is something that we have been advising our viewers that please listen to experts. Now, this is one show that focuses on what the experts say. These two, Dr. Sunil Raina and Dr. K. Gupta, are experts here for today. They are advising you for free, of course, that please maintain COVID-appropriate behavior. The pandemic is not over yet. As both the doctors are saying, we have to keep basic things right, like washing hands, maintaining social distance, wearing masks. Unless we follow that, there is, the possibility of having this pandemic being ended is obviously, we are again stretching it. So, Dr. K. Gupta, now, as you underlined about the need for following the COVID-appropriate behavior, we know that there has been a little, let's admit there has been a little slip at some places. Some people perhaps are getting a little complacent. This is what the experts are noticing. In terms of vaccination drive, and of course, the target group that we are aiming in the second phase, what would you suggest in terms of any apprehension that could arise for taking vaccine? Like we saw, if some people have hesitation, what would you advise?
See, the point is that there is no medicine. And there is one medicine, what we call as vaccination, and that will prevent the disease. So the people at our place, we, since the university is a bigger one, one of the biggest university, and we have the elderly population in our university as well. So we kept on telling the people and their families to come over, and this vaccination hesitancy, or you may call it vaccination shyness, it is not being taken care of. And the people are coming in larger number to our place, and they are getting the vaccination done. The question remains there with them, how long this antibody would be there, when I will be fully protected. These questions is still to be answered by the scientific community. We are yet to answer this thing. The only thing we are telling the people, get vaccinated, whatever response is there, at least you are saved for a time being. Maybe future publications and research outcomes may tell us how long we are going to get the immunity with this kind of a vaccination which is going on. So people are coming and they are accepting, and they are very well taken by the community at large at our place.
Well, certainly, sir, these are questions that's always been asked by people, even lay people, like whether after vaccination, would they be completely resistant towards having any sort of, infection or any, I would say, will they still be prone towards COVID? Talking of COVID and of course the issues regarding it, Dr. Raina, here we have seen a new phenomenon, of course, like that is associated with the virus, that's of mutants. When we talk of mutants and of course vaccination drive, what are the special care people need to take even after having vaccination vis-a-vis the new mutants or new strains of virus?
Right. Before I answer this question, you asked, Dr. Gupta, a very important question. What do we need to tell people for
Absolutely. Please
vaccination?
go ahead, sir. Yeah.
Yes, yes.
Yeah, yeah, yeah.
Now you need to tell people two things. That India's healthcare system runs one of the most successful vaccination programs that is run across the world. We run the universal immunization program for the kids and the mothers. And most of us get our kids vaccinated under that universal immunization program only. We trust the Indian vaccines on that. So this vaccination program for COVID-19 is being run on the same platform that runs this universal immunization program. So if we are successful with universal immunization, we are successful with this COVID-19 vaccination as well. Second, a large part of this world is depending on us for vaccines. If they can trust us for vaccines, why can't our own people trust us for vaccines? We are very good in vaccination. We supply about 70% of vaccines to the world. We are the vaccine pharmacy of the world. So if the entire world can wait for us, they can ask for our vaccines. Why can't our own Indian people take these vaccines? So probably these two things need to be told to everybody, that we are very good at vaccination, we're developing vaccines, and we are very good at running a program for vaccination. Take use of it, get vaccinated. The second question that you asked was, what will happen? We get vaccinated and if there are any mutations. We need to understand one basic thing. Even if there are mutations, the COVID-19 the SARS-CoV-2 virus that caused the pandemic may not be eliminated totally from this earth. It may stay there and may continue to infect people at different levels. It may not be the number one, the most popular virus circulating around us and causing the disease, but it will continue to be here and may cause the disease every now and then. So getting vaccinated will at least help us prevent ourselves from this particular virus for a large period of time. As the studies say, may prevent us for 6 months to 1 year, and then maybe the more popular viruses may get into circulation and may be the leading cause of the disease. But this will help us prevent at least against this particular virus. The second question that you asked, the third question that you asked was what we need to be doing. Now, we need to be using COVID appropriate behavior even after vaccination. Even after vaccination, we need to continue with this. Because unless and until, you need to understand, unless and until the large population of the country is vaccinated, we are likely to spread the infection despite the fact that we may have got vaccinated. We may not get infected to a large extent. We may not carry a large morbidity. We may not have a large mortality because of the fact that we got vaccinated, but we may continue to transfer the virus to those who have not been vaccinated. So that till the time we achieve a large number of population with vaccine, we cover a large number of population with vaccines, we will need to continue with COVID appropriate behavior. We will need to move around with care in the population because we also need to save those who have not been vaccinated till now.
Right, right, absolutely. Dr. Gupta, as we're discussing about the mutants here, we have seen few studies, of course, and there have been some mutants in India as well, be it UK, be it South African strain, extent of spread. I mean, is there a study? Is there something that we need to worry about?
Yeah, there are the studies, and these mutations were there in the spike protein, and of which somewhere around disease and spread of the disease. So these three mutations which are there in the spike protein, they are responsible for the UK strain spread. And in our country, I don't think there is any particular study. However, we have one cluster at the Shiv Gange cluster, which we call it in southern part of the country. There is a place which is known as Shiv Gange. So there is the people who came from the other place, other country, and they had this kind, and there was an strep, and they have been strictly quarantined by the government there. And there was possibly they stopped the spread of that particular strain. So far in our eastern part of this country, we didn't find any strain which are the mutant strain. So far, the study which is going on and the samples which are being sent to the appropriate laboratories at either the ICMR or Pune. So we do not have.
Right. So as we go towards closing the show, and of course, as you've already advised that we have to be extremely careful, and of course, like other people here has to be extremely careful. They should listen to the experts here. So one last question about it. Like now, as we look towards the comorbidities and the vaccination drive, how is there a certain number or proportion of people to be vaccinated that the medical fraternity is looking at? Say why I'm asking this question, we are often being asked by people, will every Indian, the last of Indian would be required to vaccinate it, or there is a threshold that once we achieve that, we are fairly safe? Is that we are aiming at? Dr. Gupta, let me start with you first.
Yeah, what we call and discuss as herd immunity. Now, let us say 60% population, if they are vaccinated or they acquire the immunity, probably we are safe, and the spread, the R naught, which the probably Dr. Rana will be more wiser to tell about the R naught factor, which is important in the COVID-19 is spread. Let us say finally that if the 60% population is vaccinated or they acquire the immunity in one way or other, probably we will be able to contain the disease.
Dr. Rana, your take on that?
Probably we need to understand herd immunity in a better way than we have been understanding it.
Okay.
Now, if you look at herd immunity says that a fixed number of people are vaccinated at one point in time, and this herd will grow as a cohort. Now, this will grow as a group and continue to protect others. With this COVID-19, if you are targeting a herd, and if you are saying, as Dr. Gupta said, 60%, about which I'm not very sure at this point in time, because we will need to know the critical threshold for herd immunity against COVID-19. So if you are targeting maybe around 60 crore, that critical threshold is 60%, that critical threshold will be 80 crore. So you will need 3-4 years to vaccinate those 80 crores. And by the time those 80 crore will be vaccinated, the first part, the initial part of the cohort may lose their immunity to the disease itself. So we won't be able to create a cohort or a group of people with the immunity at one point in time. It may take us a very long period of time. So banking on herd immunity as a protection against infection may not be the correct way to see it. The correct way to see it is the same. Keep the distance, isolate the patients,
Absolutely.
treat as many as possible, restrict the movement of those who have the comorbidity, and that is going to save you from the disease as such.
Right. Absolutely. Many thanks, Dr. Sunil Rana. Many thanks, Dr. K.K. Gupta, for discussing this really important issue. And of course, like advising all those who are watching this program as to what they need to do so as to keep this pandemic away. And this is also our appeal to all our viewers. Here is a look. Please keep wearing a mask, keep washing your hands, keep maintaining physical distancing. Remember, these are small things, what it takes to defeat a pandemic. That's it in this edition of India Fights Back. Thank you and goodbye.
देखिए देश देशांतर।